Why did we start ImmuneWorks? One reason was, could we take discoveries from a laboratory at a university and bring it forth and help patients? We write grants all the time that say we're going to help humans with their health, but can we actually do that? My interest was from an autoimmune standpoint, where my research had been ongoing for over 20 years, and could we use this research that originated in Dave Wilk's lab to help patients who have an autoimmune disease, and then could we expand that to other indications? From the discoveries, we know that in at least 40% of these patients, they display multiple aspects of autoimmunity. They show us in their serum autoantibodies. They show us with their cells the ability to attack type 5 collagen. So we know there's a subset of these patients who have an ongoing autoimmune response. We believe this is very important because in order to go from an injured lung into a healed lung, there's an immunology process that's ongoing, and the aspect of anti-collagen 5 autoimmunity may alter that pathway, resulting in the fibrotic response and preventing the healing response. And so we think that the reason these patients continually get worse and worse and eventually die is because they can no longer heal, they just get worse and worse through fibrosis. So there's one set of data we've seen from samples from the University of Pittsburgh where patients who have ongoing anti-collagen 5 autoimmunity have a much greater decrease in lung function over time as compared to those patients who do not have that. In another study from samples at the University of California at San Francisco, we see that patients who have an ongoing autoimmune response against collagen 5 are at much greater risk for death as compared to those who do not. And we've also seen in lung transplant patients that those who have an anti-collagen 5 autoimmune response are more likely to reject their lung and develop and die due to lung failure. If we can get the lung to move more into healing and less into fibrosis, the patient's lung function will stabilize and they will be able to live a longer life.